Mga katropa, samahan kami sa loob ng isang oras sa pagtalakay sa asenso, tagumpay, hinagpis, tuwa, ilan lamang sa pagsasarawan ng mga kapatid nating overseas Filipino workers. Dito lamang sa palatuntunang Buhay OFW Ngayon. Siyensya, teknolohiya at iba pa. Tumutok at matuto dito lamang sa inyong himpilan ng Katropa Radio. DWWD, Buhay OFW Ngayon. Siyensya, teknolohiya at iba pa.
Bayan ko na handa, ako ngayon'y nag-iisa, nais kong magbalik sa iyo, bayan ko. Patawarin mo ako kung ako'y nagkamali sa landas.
Forum of 83-year-old Kamuning Bakery Cafe. Today we have a very interesting, important topic. Si Clarissa, wala pa yata? Okay na? Yes. We have a very important topic here at Pandesal Forum. This August, most people are not aware, August is National Land Month. That means this is the month where in the Philippines we hope to promote better protection of the lungs, the health of the lungs. This morning we have representatives of public health and anti-smoking, anti-vape NGOs here campaigning and advocating smoke-free and vape-free Philippines. The title of our topic today is Wala Lang. How vape-free and smoke-free environment will keep your lungs healthy. We have beside me the resource speakers, our panelists, some of the best medical practitioners in the Philippines, plus NGO leaders. I'll introduce, this is not according to age or any... So on my right, Dr. Cory Abansenia. Later on, I will ask everyone to make their opening statement about the topic. Dr. Cory Abansenia, beside me, is with the Philippine Pediatric Society. She is a very special speaker and guest, not only because she is an outstanding doctor, medical doctor. Dr. Cory Abansenia also, na marites ko kanina, is half-century customer already of Kamuning Bakery Cafe. Half-century, she looks young. Yes, she looks young. She was still a child in the early 19th. Empanada, 50 years ago, ito. Our staff has served, pinainit ang empanada. So while they are speaking, we will have empanada. Thank you. Yan. Special request of Dr. Cory Abansenia. Ay, hindi niya. Ano lang, minention lang niya in childhood memory niya. Very interesting. Thank you. So we'll start. Before you bite your empanada, sorry, Dr. Cory Abansenia, can we request you to give an opening statement? Philippine Pediatric Society official.
Magandang umaga po sa inyong lahat. Aside from a pediatrician, pediatric pulmonologist din po ako of the Philippine Academy of Pediatric. So, maganda na naimbitahan kami itong umaga kasi dahil nga lang month. So, importante na pangalagaan natin ang ating mga baga. And isa na dito, no-brainer, di ba? Siyempre, paninigarilyo at ang vaping, hindi maganda sa ating kalusugan, lalo na sa ating baga. So, itong umaga, gusto ko lang ipaliwanag sa inyo kung bakit dapat wala sa ating kapaligiran ang paninigarilyo at ang vaping. Thank you.
Thank you very much. Later on, we will grill her and ask her whether it's true vaping is also bad for the health, not only smoking. So next, we'd like to invite Miss Imelda Gocotano to speak, all the way from Davao, lead of Parents Against Vape. Thank you.
Hello po, good morning po sa lahat. Kami po, we Parents Against Vape po, a coalition of parents and concerned citizens against vaping and smoking of novel and heated tobacco products are saddened and alarmed over the lapsing into law of the Vape Bill 2020. The vape law is law of lies and vape. We believe that vape products contain the highly addicting nicotine, which is toxic to developing fetuses and harm the developing adolescent's brain. The fact still remains that e-cigarette po and its e-waste are not safe. Any product po, derivative of tobacco is really harmful and may be addictive. Yet, the tobacco companies want their products easily accessible, especially to our children. The law po must be reversed to protect the Filipino youth from the harms of these toxic products. Our legislators should uphold and implement recently enacted laws and policies on e-cigarette and heated tobacco products like RA 11346, RA 11467, 106, EO 106 issued by President Duterte, and DOH AO number 2020-0055. At a time that we are in a health emergency and fighting for our lives and survival, we cannot let another epidemic to happen to our children and the youth. We cannot bet on a future where our children are addicted to these nicotine products. We object this new law allowing harmless products be promoted, accessible, and sold out to our children. We urge our fellow parents to stay vigilant and help in protecting our children from these toxic and undesirable products. We call on our legislators to pass a law for our children's future. As parents, we want a future free from tobacco and nicotine addiction. So we should also promote a smoke-free and vape-free environment. Maraming salamat po.
Thank you very much. That's from Davao, Ms. Imelda Gocotano. Next, we'd like to invite for opening statement, Attorney Benedict Nisperos, Consultant for Health Justice NGO.
Magandang umaga po sa ating lahat. Again, maraming salamat po sa pag-imbita ulit sa amin sa Health Justice para mag-participate sa isang pagpupulong ngayon with our friends from the media. Kami po sa Health Justice ay naniniwala na dapat protektahan ang kalusugan, lalong-lalo na ng ating mga kabataan, at especially also yung mga hindi nag-smoke, no? And with the passage of, or relapsing of into law of the Vape Bill of 2022, ang kukuhan po niya RA 11900. No? So ang gusto natin, dapat na matutukan yung pag-implement nito at kung maaari ma-reverse at maamyandahan pa ito. May mga batas na gustong i-amendo. Kasi ang pananaw po namin, sa pananaw po ng mga health advocates, masama sa kalusugan ang vaping at heated tobacco products. Ito po ay threat sa ating mga kabataan at kaya naman kailangan tayong magtulungan, no, para sa mas striktong polisiya tungkol dito. Lalong-lalong epekto nito sa ating environment, in terms of public vaping and smoking. Yun lamang po. Maraming salamat.
Thank you very much, Attorney Benedict Nisperos. May i-add lang si Dr. Cory Abansenia sa opening statement niya. But before that, may nag-text dito sa akin, isang journalist na sa Zoom, sabi niya, based sa research niya, in the Philippines today, there are 16.6 million people in the Philippines who smoke and suffer from the problem ng smoking. That is 23.8% of the entire population of the Philippines. I think that is more serious long-term health threat than even COVID. Dr. Cory Abansenia would like to add to her opening statement. Welcome, Doctor.
Thank you. Kala ko naman pag opening statement, greeting lang. Okay, so we'll make it very informal. Okay, so, kasi di ba alam naman natin na masama ang sigarilyo. And being a pediatrician and a pediatric pulmonologist, anong ibig sabihin nito? So, paano affected ang mga bata kung sila hindi pa naninigarilyo? So, do you know na ang buntis, so sa sinapupunan niya, di ba, meron na baby, pag siya naninigarilyo o kung siya nakakalanghap ng sigarilyo, so pag nakalanghap, you're not a smoker, you're inhaling the second-hand smoke. And there's this concept pa of the third-hand smoke. Yun yung naninigarilyo ka, pero kunwari sa loob ng bahay, didikit sa dingding, didikit sa sahig, sa damit nyo. Okay, so, kunwari buntis, affected na kaagad yung baby. Merong chance na yung maliit yung bata pagkalabas. Maaaring may mga congenital anomalies yung bata pagkalabas. Tapos habang lumalaki yung bata, nakikita niya ang parents na naninigarilyo. So, nandiyan yung mga smoke-related injuries. Tapos sila yung, pag teenager na sila, peer pressure, kasi nakikita nila mga magulang nila naninigarilyo. So, sila yung mas may chance na mag-pick up din ng habit. Okay? And this is just before pa traditional cigarette, di ba? Tapos ngayon, meron pang vaping. Akala ng mga tao, pag nag-vape, harm reduction. Okay? Sana, di ba? That's what we want. Pero, hindi pa laganap yung mga pag-aaral tungkol dito. So far, ang nakikita sa vaping, yung e-juice, kasi di ba, akala ng lahat dahil sa sigarilyo, yun yung nakakakos ng lung cancer. Yun yung nakakakos ng mga, and lung cancer is just one of the cancers. Merong throat cancer, stomach cancer. So, aside from that, meron pang, kunwari ang kausap mo bata, anong pwede mangyari sa kanila? Yung sports sila, mahirapan sila mag-sports. Sila yung mga ipin nila, maitim, di ba? Kasi sila yung mabilis mag-dry yung skin. So, merong mga mild na side effects, pero may mga nakakamatay. Okay, tapos sila yung pag naninigarilyo, yun yung alam lang natin, hypertension, di ba? Yung mga pwede nakakamatay. Pero ang vaping, if they are marketing it as a harm reduction, they can't say that yet for sure. Kasi, ngayon pa lang yung pag-aaral. Tapos ano yung mga sangkap ng e-juice? These are ingredients that we are already using for food. Pwede siyang food coloring, di ba? So yung mga food flavoring. So yung propylene glycol, siya yung, di ba pag naninigarilyo ka, mararamdaman mo. So yun yung vegetable. So yun sa vaping, yun yun. Tapos diba yung cloud tricks, yun yung vegetable glycerine. So, kala mo healthy vegetable glycerine. It is generally regarded as safe pag kinain. Pero pag linanghap mo, it's shown na hindi siya safe. Okay? So yun din yun. So, hindi siya safe. So, ngayon, ang nangyayari is, minamarket nila as harm reduction ang vaping. So, okay, siguro kung naninigarilyo ka na, okay. Pero, it's sold in the market. It's sold in, di ba, yung mga online shopping, sa mga Lazada, sa mga Shopee, you see it. So, ang problema doon is, pwede siyang mabili ng kabataan. And, ang nakakalungkot pa, supposedly, meron ng law ng 21 and above. The sad thing is, yung vape law, binababa nila from 21 ang pwede nang bumili, 18 years old. And, ito, first-hand experience, kasi may pasyente ko, she's 15. Ang style ko, I'll ask them, do you vape or do your friends vape? Apparently, yung mga older, ay mga adolescents, they will buy and sell it to the younger ones. So, di ba, I mean, there's a will, there's a way, di ba? So, it's not enough na kami mga doktor yung nagtuturo sa mga pasyente natin. Kailangan, merong law to help us with our patients. Kasi ang mangyayari, sa amin din babagsak po yung problema. Kasi, baga, and there's such an illness called E-cigarette vaping association. mga simptomas doon is the regular, kala mo lang, lagnat, sakit lang ang lalamunan, may ubo lang, hirap huminga. If hindi namin makitaan ng rason kung bakit siya nagkakaganon, tapos ang nasa history is nag-vape siya ng 3 buwan, and nagkaroon ng mga namatay sa US, and it's because of Ivali. So, imagine it's just in the history, 3 months of vaping, and you get sick, that's Ivali already. So, huwag natin payagan na magkaroon tayo ng ganong epidemya because we're already seeing it. Tapos sa pag-aaral, sa aming mga doktor, importante pag-aaral. You know, numbers don't lie, science doesn't lie. So, it can't just be 1 doctor or 2 doctors who use vape probably, diba? And maybe it helped them, good for them. But what we are doing is protecting the children. So, and yung edad na 21, hindi lang namin yung hinulaan. Ang utak natin is developing, and it's well developed by 25 years old. Kung hindi ka naninigarilyo, meron tayong nicotine receptor. And yung nicotine receptor, it's tulog lang yan. Then once you smoke, the nicotine will go to that receptor, gigisingin niya. And what's in that part of the brain? Siya yung pang higher learning. So, imagine anak mo dahil nag-start manigarilyo, sayang kung hindi niya ma-attain yung full potential niya. It is also the part of the brain yung sa moods. Siya yung sa memory. So, all those will help your child. So, kaya kailangan tutulungan natin na hindi bumaba yung pagbili ng sigarilyo at ng vape. And ang naging rason nila, Sir Wilson, was, kasi ang sigarilyo 18 years old So, ibaba na lang natin yung vape para pareho sila. If that's their reasoning, is sana yung sigarilyo gawin din nilang 21. Diba? Pagandahin nila lahat. Hindi yung, sige, para pareho na lang, gawin natin pareho 18 years old. So, because the brain is not fully developed to 25 years old, that's why we wanted 21. And 21 was actually just a compromise. We would have wanted 25. And then the flavors. Diba, ang alam lang naman natin dati, the tobacco, tsaka yung menthol. Pero ang vape, di ba, mabango siya. May cotton candy flavor, may chocolate flavor, may strawberry flavor. And who's gonna entice those flavors? Diba, children, cotton candy flavor. Diba? And fine, mga smokers would want to quit and they would, probably buy the flavored ones. But you are also enticing the non-smokers and the youth. And then yung mga, may pag-aaral din na nakikita na, yung mga nag-quit na, because of the vaping, they went back to smoking because naging dual users sila. And then, ang naging problema pa dito is, the vaping is a gateway to other vices. So, ang nakita sa pag-aaral is, kunwari, nag-umpisa ng vaping, they are more likely to pick up the traditional smoking habit. They are more likely to be excessive alcohol drinkers. They are more likely to try marijuana. So, imagine ko anak niya yung gano'n, di ba? So, hindi niyo syempre gusto yung mga anak niyo, mga kamag-anak niyo, ang mag-pick up ng smoking habit or even ng vaping. And me growing up, my dad used to say, I don't care if you smoke, just don't burn my money. So it was just about, di ba, it was just, kasi noon, my dad would say na, ako, nag-start na ako manigarilyo kasi riniligaluhan na ako when he was working. Binibigyan siya ng mga tobacco, di ba? So, he would proudly say that he started to smoke because he was already being gifted, so he never used his own money. So that's how I grew up. And I would say, I was smoking. I was a social smoker. I tried vaping, diba? And I was, 14 years old when I started to puff. And yun it's the puffing na doon. Uubo ko naman talaga una but because of peer pressure, because of you'll try again until next thing you know, you're addicted to it. And it's the nicotine that will make you addicted to it. You don't die from nicotine, you die from tar. But it's the nicotine that will make you addicted. Okay? Nag-lecture na no? Ano pa ba? Okay, so sana maturuan niyo mga pamilya nyo. And if you're in the media, maganda na you tell your listeners and your readers about it. And it's not, and kaming mga doktor, mas gusto ko lang na nasa pasyente, di ba, magpagaling ng pasyente. But we do this because we know it's good for the Filipino child. Thank you po.
Thank you very much. Crash course eye-opener on the danger dangers of vaping and smoking. We have with us also, as thank you, Dr. Corey Abansenia. Later on, we'll ask questions to all of them. Last but not the least, via Zoom, we have another special guest, panelist, President siya of Philippine College of Chest Physicians, Dr. Imelda Mateo, to give an opening statement about the issue of lungs, vaping, and smoking. Dr. Imelda Mateo.
Ako po si Dr. Imelda Mateo. You can call me Doc, I mean for short. So, in behalf of the Philippine College of Chest Physicians, isang grupo po ng mga specialista sa bata, sa adult. Counterpart po kami ni Dr. young smoker, kami po ang sasagot kung ano ang magiging so kami po together with the Department of Health, kasama ang Philippine Medical Association. Lahat po din ng mga asosasyon ng medical, the Philippine College of Physicians, the Philippine Pediatric Society, yan po ang the society for we abhor and we are saddened by the lapsing behavior of the bill. Alam ko natin kung ano ang na you make it more available, increasing accessibility. Tama po, hindi po kami naniniwala na nagsasabi na less harm is better than smoking, than vaping. For a long time, like more than 10 years, 20 years, more than 20 years now. Pero, nakikita na rin po sa mga latest na pag-aaral, ay yung mga smoker, it is a gateway to smoking cigarette talaga and taking in of nicotine. Sa mga bata na hindi naman smoker, pero i-challenge mo natin, eventually po talaga smoker po sila. And ito po ang long-term effect, no? Pero paano na yung mga panandaliang nakita na po at reported na yung mga sumabog na vape gadget, no, sa bibig, yung nagkaroon ng fire, yung monkey valley na directly by personal experience po, recently na, 3 weeks ago, nagkaroon ako ng isang pasyente na 21 years old. Ang future ko ng bata, gusto niyang maging doktor pa, no? Medical po kasi siya. At he has been smoking for less than 10 years, pero nag-shift po sa vaping. Nagkaroon po siya ng komplikasyon sa baga. Tulad ng isang chronic smoker. Ibig sabihin, in vaping, you see the harmful effects as early as less than 3 years, as early as less than 3 months, na hindi mo natin nakikita na isang regular smoker na gumagamit ng cigarette smoke lang, tobacco products. So, yun ang stand natin. In fact, if there is a way na sana marinig na ating mga presidente na nag-lock sa law ang vape bill kung may magagawa ko po sana. Na sana yun ang dasal at kiling natin. Kaya alam po natin kung ano ang catastrophe ko. The first hand smoke, the second hand smoke, the third hand smoke, nandyan po din lahat yan, hindi lang sa tobacco products, kundi po sa mga chemical contained in the liquid used in vaping. So, nandyan po kami, kaagapay nyo, at kayo po ang partners namin sa media na mag-akalat ng informasyon para maging vigilant po tayo at we fight for a cleaner, healthier air.
Thank you, Dr. Amy Mateo of the Philippine College of Chest Physicians for affirming what Dr. Corey Abansenia also said, na hindi totoo vaping is less harmful, it is still harmful and dangerous. like smoking. Next, before we go to the question and answer portion with the media here via Zoom, they will show a video. They will show a video about vaping and smoking dangers. Can we show the video? We'll show the video via Zoom lang or here? Yes, we can see the video here. Paki-play yung video. Who will assist video? Very enlightening kanina sinabi nung dalawang doktor and the two NGO leaders here for panelists. It's not true, vaping is not harmful, not true. So we'll ask later on more details. At saka, when this bill lapses into law, and what can be done by the legislators to correct this error. While waiting for the video, baka we could ask any of the panelists dito, when did it lapse into law and what can be done to reverse this lapsing into law, if ever?
Maraming salamat, Sir Wilson. No? That's a very timely question dahil meron na tayong vape law na tinatawag. Ito po yung nag-lapse noong July 25. Ano? And nababase po dun sa batas, meron pong 3 buwan. Binibigyan ang DTI at in coordination with the relevant agencies na gawin yung implementing rules and regulations. So may 3 buwan pa po no, para gawin yun. At magtra-transition pa po ng 18 months ang batas bago ma-fully implement. Ibig sabihin, meron po tayong almost 2 years na i-shake up, i-reverse, or i-amend yung masamang batas na ito, no? Isipin na masamang batas para sa mga kabataan, para ma-reverse po ano, at maging bumalik dun sa stricter regulation na meron po tayo. So, iklaro lang po natin, no? Pumasa po ang vape law, nag-lapse po ito noong July 25. Pero in the meantime, ang batas po na applicable pa po sa atin ay ang mga batas on sin tax na pinasa po ni Senator Pia Cayetano. At ito pong sin tax laws na RA 11346 at RA 11467, sinasabi pa rin po doon na ang access sa vape products at heated tobacco products ay 21 years old below, restricted po yan. So, now, until the next almost 2 years, yun po yung applicable na batas. Bawal din po ang flavoring in the next couple of 2 years, no? Almost 2 years. So, ang mga flavorings na nakikita nyo po sa mga tindahan, bawal po yun. 2 lang po ang inaalaw ng batas, plain tobacco at plain menthol. Bawal din po ang access ng non-smokers. So, kung hindi ka nag-smoke, hindi ka dapat gumagamit ng vapes at heated tobacco products. At ang may jurisdiction po rin po dito ay ang Food and Drug Administration. And yun nga po, yung other provisions ng 2 batas na sinabi ko, katulad ng graphic health warning, yun pa rin po yung applicable. So hindi po, klaruhin lang po natin no, sa ating samahan sa media at sa mga nanonood ano, na stricto pa rin yung ating naka-implement na batas. Meron nga tayong Vape Law 2022, we have almost 21 months for the transition. Ano. Kaya dapat, kaya panawagan po natin, ang Food and Drug Administration ay maging alerto sa pag-implement ng batas pa rin na applicable ngayon. At dapat i-check no, yung mga nagbebenta online, dapat pagbawal din yan, at mga access ng mga produktong ito. Kasi at the end of the day, we want to protect our children and the non-smokers also. No? Gusto natin protektahan yung kanilang lungs, lalo ngayon, Agosto, sabi nga ni Sir Wilson at sa ni Dr. Cory, lung month. Ano? Sana maging significant dito at gawin natin no, na ma-implement itong strictong regulasyon within the period na inaalaw ng batas. Tungkol naman po sa mga pwede natin gawin para maamyendahan or para mas maprotektahan pa ang ating mga kabataan, meron na pong pinasang bill ano, si Senator Pia Cayetano. Kasi sa pananaw niya, ang vape law na nag-lapse ay masama sa mga kabataan. Ito'y nag-i-engganyo sa mga kabataan para gumamit ng mga produktong vapes. Ang gusto niya, ma-revert back dun sa sin tax law na naipasa niya noon dati ang batas. Kanya naman nagpasa na po siya ng kanyang Senate bill. At susuportahan po natin ito. At sana po within the almost 2 years na period na pwede pa po tayong mag-amyenda ng batas bago ma-implement yung vape law, ay magawa natin na ma-reverse itong mga provision na ito. Sa mababang kapulungan naman or sa House of Representatives, nakikipag-usap na po tayo sa ating mga partners, mga health champions, para magpasa rin po ng countermeasure na kasabay po nung Senate bill ni Senator Pia Cayetano. Kami po ay umaasa at nananawagan sa ating mga mambabatas na gawin natin na mas protective at mas strict regulation sa vapes at sa heated tobacco products. Kasi that is what will protect our children and non-smokers from the use of these products. Lung month, ang matinding tinitira po ng vape at heated tobacco products ay ang lungs. Alam natin, nag-issue na rin ng World Health Organization ng panawagan, no? Dapat strict yung pag-regulate ng mga ito dahil malaki ang epekto nito sa lungs, malaki ang risk o harm na may maging epekto nito, lalong-lalo na, no? Meron pa din po tayong COVID, pandemic pa rin po tayo, marami pa rin pong nagkakasakit at namamatay through COVID, so we have to protect our lungs, we have to protect our children, and also the non-smokers from these harmful and toxic products. Thank you po.
Thank you very much. May tanong pa dito. Doctor, kanina na-mention ninyo, Dr. Coria Bansenya, you started smoking at 14. Paano kayo nakastop? At what age? And what can people do to stop vaping, stop smoking? What do they see you? Do they go to hospital?
Okay. Ano ko, fake news ho yung naninigarilyo ko since 14 ha. Okay. Sumubok lang ako.
Sumubok. Sorry. Ayan,
Okay.
yan ang mga marites. Pag nagkamali sa parinig, iba na. So, sumubok lang kayo, pero ay inayaw ninyo.
Yes.
Very good, very good.
The thing is, kunwari, 14 ako, sumubok
Yes.
ako dahil meron akong teenager na pinsan na just try it, diba? So, isubok, choke.
Pwede din nagustuhan.
Hindi ko nagustuhan.
Buti naman.
But, like, I was telling nga si Ate Tess kanina, when I was in med school, so merong part na nagre-revalid ako, aral-aral, and then parang just to break the monotony, I would smoke, from stress. But the thing is, kasi hindi natin dapat i-judge yung mga naninigarilyo na, di ba? Kasi it's the effect of...
Biktima sila.
Yes, they're victims. Okay, so that's why parang ang pananaw ko, yung mga gumagamit ng vape, maybe they're the smokers who really wanna quit, di ba? They really wanna quit and they really think na nakakatulong sa kanila ang vape. So, kailangan ikaw mismo ang may gusto tumigil. So, maghanap ka ng goal. If you're not gonna do it for yourself, do it for your children. Diba? Gawin nyo para sa apo nyo. So, kasi kailangan sa inyo manggaling. Kahit anong pamipilit, gawin ng doktor nyo, ng asawa nyo. Kasi mga iba, diba? I know people, they would hide. Diba? And they're my friends, diba? They're my good friends. And I used to smoke. Ito, sige. Hindi, wag nyo ito susulat, ha? Okay. Off the record. Off the record. My best friend smokes. Okay. Because her parents smoke. And then, so I would smoke with her. Diba? Lalabas kami. So, pagbusog, sarap mag-smoke, diba? And then, I remember, we were smoking in a small room because we were in the condo of her sister. Doon ako sobrang nahilo. And sobrang nauseous. After that, I didn't wanna smoke anymore at all. Okay, so, minsan hahanap ko, kasi, wala naman, off the record pa rin to, kasi wala namang anak, walang ganyan, okay lang sa akin, di ba? Because I'm, parang I lived a full life, di ba? But for other people, you have to look for a reason why you wanna smoke, and then why you wanna stop smoking. And then if you do, hindi kasi pwedeng ikaw lang hahanap ka ng tulong. You tell your family, merong DOH quit line. So, there is a DOH
So there is
quit line.
the Department of Health quit line. You can go and seek help.
Yes, you can. And then you tell your family. This parent yung mga, if you feel like smoking, inom ka na lang ng tubig. You do other things, diba? You keep yourself busy. Be with other people who are not smoking. This you tell them na, pag nakita mo akong magsigarilyo, tell me. Minsan, mahirap talaga talaga na ikaw lang kasi. So you really have to ask for help. And for those who think that vaping will help them, mas maganda na guided ka ng doktor. Kasi based on studies, hindi pa. Diba? Sana, diba?
So you're saying, you and Dr. Mateo are saying na yung claims of those vape sector not yet conclusive, not yet 100% sure. Their claim that it's better than cigarette smoking.
Yes. And ang nakakatawa dito is the proponents of the vape bill, di ba, gusto nila DTI. Ang nakakatawa, they were...
bakit DTI dapat sa DOH or
dapat
FDA?
FDA, di ba? Kasi anything...
Oh, that's very good point.
Yeah, di ba? Nag-note si...
Oo, nanonood ako.
The thing is kasi, di ba, you're saying na anything that affects the health, dapat FDA. So, ultimo makeup, lotion, di ba? That's under...
Ayaw, pati candy.
Candy, that's all under FDA. You wanna see every component of whatever you're taking in, di ba? So, no-brainer na FDA, di ba? Health. But what was funny was, when they were trying to, the proponents of the bill, they were citing studies of FDA of other countries. So, ang nakakatawa doon, parang sa buong mundo, tama ba, sir? Parang ngayon lang na under DTI ang vape.
So this is anomalous, a very weird situation we have here in the Philippines. Vape products should have been under Food and Drug Administration, but now under this vape law that lapsed into law, it's now under Department of Trade.
So maybe the gadget, but the e-juice definitely has to be under FDA. Kasi yung isang cup ng juice, yun yung ini-inhale mo.
Yes.
So maybe, sige, yung gadget mismo, DTI, but the e-juice definitely has to be reviewed by FDA.
Reviewed and regulated and checked and approved. Very good, very good.
Yes, exactly. And sa ibang bansa kasi, iba-iba yung sangkap ng e-juice and even the nicotine content kung may limit. It's just that now, you know, it's so easy to buy products from other countries, di ba? So, hindi naman yan lahat na-check. So, that's important. That's why it's important that we really regulate it.
Thank you very much, Dr. Vansenia. So, it's very dangerous. For all the health advocates dito, especially the parents and the health justice advocate and others, what is your appeal? Can the new president do something pa since it already lapsed into law? He could no longer veto it. Kasi in fairness to the new president, nagulat tayo, he has been vetoing laws that he thinks are not good for the country. Even laws and bills proposed by his friends and supporters, surprisingly. So, can he still do something or no more? It's already with the Congress. Is it already with Congress and Senate?
As for the President, naniniwala tayo na ang interest ng Presidente ay public health. He's the President not only of his friends or of
he
his...
He doesn't smoke, diba? He's a health buff.
Yes.
The gym dog, look at him, he doesn't have a stomach.
At saka, hindi lang siya presidente ng mga tobacco-producing provinces, no? He's the president of the Filipino people, and we believe that the president would promote the right of the people to health, And with that, guided by science and guided by education also, by the information from our health experts, from our institutions, I think the President would decide to call his allies in Congress to promote a bill or a law that would be stricter in regulating vapes and heated tobacco products. What we can ask from the President is for him to order the Department of Health and the Food and Drug Administration to be strict in implementing of the current law, the stricter provisions, because we still have about 21 months before we transition to the new vape law. And be strict, sabihin po niya na FDA, DOH, tingnan nyo kung sino nag-violate ng regulations on flavoring. Kasi as of now, until the next 21 months, bawal po ang flavored e-cigarettes and vape products. Bawal din ang access ng 21 years old below. Bawal din ang non-smokers. Dapat may graphic health warning. Dapat ang FDA ang may jurisdiction. All those provisions that are stricter are still in effect until we transition to the new vape law, no? Kasi yung vape law, nagsasabi na rin po doon, no? 3 months for the IRR, 18 months for the transition into the new law. So, irespeto natin yung prosesong yon. So, until the next 21 months, at the very minimum, strict regulation po ang dapat na implement. And I think the President has all the authority to mandate that we strictly implement these laws while we are waiting for that. And at the same time, we ask him to support, no, for example, the bill of Senator Pia Cayetano that would reverse back to stricter regulation, the Vape Law 2022, and call on his allies in the lower house, in the House of Representatives, to pass a complementary bill para tuloy-tuloy na po, no, na maging strict ang regulation ng mga produktong ito. And that's, sabi nga ni Doc Avancenia, it's really no-brainer, no? Because science is telling us that stricter regulation will help our youth and our children and will lead them away from these harmful products. It will prevent nicotine addiction and it will not entice non-smokers from using these products. Yun ang kagustuhan natin. We want to lessen the number of cigarette smokers, while at the same time, we want to prevent the youth and the non-smokers from using vape and heated tobacco products.
Thank you. That's Attorney Benedict Nisperos. May tanong dito, Miss Imelda Gocotano. Kamusta naman your side parents against vape? What are you hoping from our politicians, legislators? Can they do something still? And how is your city, Davao, if I'm not mistaken, is the first city in the country na no public smoking, I think, when former President Duterte was your mayor. Is it true?
Yes po, and hanggang ngayon po, ganun pa rin po na bawal po ang manigarilyo po sa mga public places po.
Wow. Do you want it nationwide? Is there a law nationwide to make the whole Philippines like Davao?
Yes, maganda po yun. Gayahin po ng ibang provinces, the whole Philippines po, kung maaari ang ginagawa ng Davao City na pinagbabawal po sa mga public places ang manigarilyo po. So maganda po yun.
Ano pang lugar sa Pilipinas na parang Davao City na parang ayaw ng mayor o governor sa smoking? May ganyan ba? Are there any other mayors we can cite or we can encourage publicly? Sino pa? Aside from Davao City? What other places na the leader is?
Bataan, correct.
Bataan. The governor or the mayor?
I know because I was before in touch with
Yes.
Congressman Enrique Garcia.
Ah,
Sir, he was our
used to be
partner in
anti.
Congress, yes. And I know Bataan, no smoking.
Who else among the congressmen, aside from Senator Pia Cayetano, who are very passionate about anti-smoking, anti-vaping, and health lungs protection?
Okay. Well, I can only speak for myself. And
Yes.
off the record din ito.
Off the record, wala naman
Yes.
tayo dito nakikinig.
Actually,
Joke lang.
kasi di ba kami mga doktor, parang, lalo na COVID ngayon, di ba? So we're so busy sa mga pasyente namin.
And COVID is lungs, di ba?
Yes, as lungs, di ba? So kaya nagulat kami yung sa vape law and kaya ako napa-crash course tuloy ho about politics and about laughing
Yes.
into law and all that.
Yes.
But what I was doing personally was trying to get hold of senators to vote against the vape bill.
Were you trying to reach out to them?
Yes,
And you,
yes, I was.
Sinong, aside from Senator Pia Cayetano, who are the ones who are sympathetic or you are hopeful? Can you name it?
At that time, Senator Kiko Pangilinan. They were
Yes.
the only two who voted against the vape bill.
Only two.
Only two. Kaya nga nakakalungkot ho. Kasi the thing is, nagtanong ako, kasi ang alam ko lang, si Senator Pia Cayetano, yung parang was pro-health at the time. So you have to correct me, attorney. Okay. Na parang, kunwari, nag-isip sila ng bill sa Senate, tapos meron muna silang small group who will talk about it before they present it to the whole group. So, nung naging aktibo kami, mga doktor, I'm speaking for PPS and PABP, nung nalaman namin to, so we scrambled to talk to senators para pag nagbotohan, manalo yung against the vape bill. And then, alam mo, I tried to get hold of all the senators. Okay, we divided it among ourselves. So, nakausap ko yung mga staff ni Gatchalian, staff ni Senator Tito Soto, staff ni Senator Lacson. I got to talk to their staff. Staff ni Senator Pacquiao, talk to their staff. But the only one whom I got to talk personally was Senator Pangilinan. And he was one who called me. And he didn't give me false hope. So sabi ko, sige doktora, send mo sa akin, I'll study them, then I'll see. So, at least hindi niya ako pre-promise, di ba? And then come voting, he voted. So, siya lang at si Senator Pia Cayetano. And to take them, political parties or all that, not into politics, it's just that I'm pro-health. So, that's why I'm being vocal about it. So, kung sino man yung mga kaparty ni Senator Pangilinan, sino man ang kaparty ni Senator Pia Cayetano did vote for what we wanted, which was against the people. So yun ang silang dalawa, Senator Pia Cayetano and Senator Pangilinan.
Sir Wilson, madagdagan
Thank you. Yes, sir.
Question kanina on whether there's a law that prevents smoking and vaping in public. We have executive orders issued by President Duterte. Yung twin executive order niya, it's EO 26 and EO 106 in terms of 105. In terms of preventing public vaping and public smoking, no?
Still in force.
Yes, kasi hindi pa naman po na-repeat. And hopefully, panawagan natin with the new president to not repeal those EOs because those are public health EOs. Ang sinasabi po doon, bawal po ang public smoking. Very strict din kung saan bawal ang public smoking when two or more people converge. Bawal po ang public smoking at merong provision doon on designated smoking and designated vaping area. So meron po, no? But what we want from our end as advocate is to have a law that will institutionalize those executive order. Yun po yung panawagan natin, lalong-lalo ng lang month ngayong August, magkaroon ng smoke-free policy, magkaroon ng smoke-free law, isang batas na nagbabawal nga ng smoking in very definite public places, ano, at ipagbawal na rin ang indoor designated smoking areas, ano. In terms of the allies, ano, in the House of Representatives and the Senate, we continue to leverage our advocacy with our public health champions. Ano, nung nakaraang Congress, nung 18th Congress, we have Kong Rufy Biazon and Kong Joet Garcia. Kong Helen Tan, who was the head of the chairman of the Committee on Health in the lower house, were our allies. Ang insiste niyan, sir, is that all of these champions, nag-local officials na.
So what happened to Biazon? He's not a mayor?
He's now a mayor, si Kong Joet.
He's the new governor.
And then, pati rin si Doc Helen, ano? She's
Governor.
now a governor, no?
Ay, sana we should have invited Governor Garcia. He came here before to talk about bird watching and environment.
Yeah, very this shout na to.
Yes,
Minsan
okay.
nabisita namin siya sa Balanga, tapos yun nga, inikot niya kami sa mga bird watching
He spoke here
sanctuaries.
about bird watching and environment, so we'll tell him.
Sige
Wow.
po. So sila po yung champions natin, and we hope that they can influence their friends in Congress to champion public health, lalong-lalo na itong tobacco control and vape, strict vape regulation. Ano. So yun po, kami po sa advocacy, patuloy kami nakikipag-usap. Maganda dahil fresh start ulit kasi may
Yes.
mga bagong legislators.
New set of legislators.
Na pwede nating balikan, ano, lalong-lalo yung sa Senate, may mga bagong pangalan. Meron din luma na pwede rin natin mabalikan din kasi mga public health champions din kung naman yung iba sa mga na-elect. So yun, I hope that we get more champions on both houses of Congress And then we also ask for the help of the public na tulungan po kami dun sa advocacy yung to kasi this will really benefit the country, especially our youth. And we will prevent them from nicotine addiction and from effect of smoking and vaping.
Thank you again, Attorney Nisperos. Based on what you have just all said, later on we'll call si Dr. Amy Mateo, may sasabihin siya. Pero in passing lang, impression ko, all of you here para kayong underdogs. Am I correct? I have an impression that the vaping sector is big business, I think. They are very well entrenched, well connected. Maybe your voices are not very well, because they are bigger economic interests. So thank you to your courage and to the media for hearing you. Dr. Amy Mateo would like to say something before we go to the other questions pa. Dr. Mateo.
Naririnig niyo po ba ako?
Very clear ho, Dr. Amy Mateo.
Naririnig niyo po ba ako?
Yes, very clear kayo, Doctor.
Can you hear me?
We could hear you very clearly, Doctor.
Okay. May nagtanong po sa chat box kung sumulat na daw po itong ating team sa FDA tungkol sa position or yung PCCP kung sumulat daw sa FDA with the position statement about the ill effect of smoking. Alam niyo, hindi po kailangan dahil po ang FDA, dahil attached agency ng DOH, is well represented sa mga teams of advocates fighting against smoking and vaping. Kakampi na po natin sila na re-realize po nila na ang vape products, e-cigarette products, should be regulated by FDA. Ang nangyayari lang po, syempre may batas na that might be overcoming them, kahit na ang position nila is kaisa sa ating position. Hindi na po natin sila kailangan kumbinsihin dahil kumbisado na po sila na talagang masama po ang vape, e-cigarette, at smoking. Hindi po kailangan dahil kaisa natin sila. They are one of our champions as well. Kaya po, just so to answer yung query po na nag-question natin. Ngayon, i-reiterate ko lang po, para ito po ang talagang ma-emphasize natin. Yung vape bill po is not a harm reduction measure. Ang nakakalungkot po, mga doktor pa nagsasabi. But rather, smokers, lalo na sa mga bata. Kung hindi pa smoker, it encourages initiating smoking. Number 2, yung mga dati na hong smokers, they only encourage them to shift to another form of smoking. Excuse me. Ang smoking po, vaping po, is a habit. That's what we want. Ang ginagawa po natin, pinapalitan lang natin yung sigarilyo ng vape. Pero the smoker, lalo na po yung heavily dependent, heavy smoker, cannot really stop smoking unless intervention on smoking cessation is done or administered to that heavy smoker. So, hindi po kami naniniwala. In fact, it's not even supported by facts. Siguro babasihan nila yung mga unang study na nagpo-compare na less harm. Siyempre po, kasi less than 5 years or 8 years na versus smoking na ang inaaral natin yung heavy smoker na more than 10 years na, more than 25 years na. O hindi po, parang nag-uusarap tayo ng apple at orange. Hindi po, nauna po nang naging smoker for a long time. Siyempre may harm na talaga. Versus a vape na bagong product na less than a day pa lang siya talaga intensity ginagamit ng mga smokers. No comparison po. Parang hindi tama sa same level na pinapag-compare po natin. So, yun po ang totoo. Ang vaping promotes continuation of the smoking behavior. And similar to traditional cigarettes, addictive po ito. I-challenge po natin sila. Pakita nila ang content ng vape liquid. Meron po kasama nicotine yan. Because the nicotine keeps one addicted to it. Isipin mo po, bakit po sila maglalagay ng product na hindi nila na nag-ising at hindi continuously consume or utilize, so to be continuously used. And that is nicotine that keeps them addicted to continually use the product or the vape or the e-cigarette. Tumataas na po no, ang prevalence ng use of electronic cigarettes at saka ng vape. Sa Pilipino ng mga bata, 110% increase na po over 4 years from 2015 to 2019. Much more than us 3 years ago. Much more now po. This is based on the global tobacco survey. Alam po yan ang mga pediatrician ni Dr. Cory. No, inaaral po niya yan. Alam niya na sobrang na kung taas. Imagine po, 110% increase over less than 5 years. At ito po, ang magiging pasyente namin, eventually. Mabuti po umabot pa po sa adulthood. Kasi nga nakikita natin ang early catastrophic diagnosis. So, yun lang po. Yun lang po sana ang tandaan natin.
Thank you very much, Dr. Amy Mateo. Nakaka-disturb po. Catastrophic effect. Tapos 110% increase of vaping in the Philippines from 2015 to 2019. Thank you. May tanong dito from Jasmine Romero of ABS-CBN. Babasahin niya. Basahin ko na lang, no? There's a question for all our panelists here from Ms. Jasmine Romero of ABS-CBN News. How do you take President Bongbong Marcos's silence or inaction before the vape bill lapsed into law? Yun ang first question. Second questions, what are your next moves to stop this vape law? And number 3 question, will you, the NGOs here and doctors, question this vape law legally at the Supreme Court? Will you do that? Do you have the plan to do that? From Jasmine Romero of ABS-CBN.
The first was, how do we feel?
How do you feel about the silence of the new president about vape bill lapsing into law?
Okay. This is a personal, I'm not speaking for PPS or KPP, but I'm saddened and disappointed, but we're still hopeful na meron pa rin tayong magagawa and si Presidente ay makikinig sa amin. Sana makulitan sa amin, kaya na lang, di ba, dapat sa pangungulit, sana makinig sila sa amin. And in terms of we're lobbying for this because we know it's good for our country, for our Filipino children. And being a doctor and a pulmonologist, gusto natin syempre prevention. And kami, mga doktor, part sa turo sa amin is papagalingin namin yung pasyente namin. Pero apart from that, gusto namin pupunta sa amin, like ako pediatrician, mas gusto ko pupunta sa akin for prevention. Bakuna, tutulungan ko sila para hindi magkasakit. Ako nga, style ko, binibigay ko number ko sa kanila para kung tatawagan muna nila ako bago sila pumunta ng ER. So maraming doktor na gano'n. So, being a pulmonologist, so kunwari asthma, do you know na kung kahit na yung asthmatic hindi naninigarilyo, pero kung sa bahay niya may naninigarilyo, as I was saying earlier, second-hand smoke, third-hand smoke, pwede pa rin sila atakihin ng asthma. TB, lagana pa rin sa bansa natin. If, mas malaki ang chance ng isang adult na magka-TB kung siya ay naninigarilyo, mas malaki ang chance na hindi mag-work yung gamot dahil siya ay naninigarilyo. So, lahat yun affected ng paninigarilyo. So, kaya me personally, hanggat sa hindi nare-reverse ang vape law, you will still see me around. So, yun ho. So, kaya thank you ho sa pagkakataon na to na you're, hearing us, taking your time out to listen to us at sa aming mga pangungulit. Salamat po.
We'll give you more empanada for more energy.
Okay, thank you po.
Sorry to interrupt you. I'm just very curious. Kayo, saka si Dr. Mateo, Dr. Abansena, you are doctors who cure people with lung diseases caused by smoking and vaping. I'm just curious. You should, be very happy because you have so many people getting sick. Why are you very curious lang ha? Kasi based on logic, if more people get sick because of vaping, if more people get lung cancer and everything, you would be swamped with so many patients. Why are you against the harmful effects of vaping and smoking when this will make you and Dr. Mateo even more in demand. Why? Sorry I'm just very curious. Kasi di ba, based on logic, you will be having siguro 10,000 people every day lining up outside pag non-stop itong vaping. Sorry, why? Curious lang ako, sorry.
I like your question, thank you. Actually, gusto ko ho, and I'm sure all doctors naman, gusto namin mga pasyente namin buhay.
You don't want many people dying.
Yes, of course.
Because,
ayaw natin ang lumaking business, yung mga funeral homes.
Yes,
diba?
yes, I understand. And ICUs.
Yes, diba?
Yes.
And so,
sorry for that question.
No, I like it. Thank you very much.
Kasi parang, you're very good. You and Dr. Mateo are very
yeah,
good.
Hindi, tsaka na sa oath namin, diba? First,
Kaya the people here will give you many
More panadas. Okay. Kasi sa amin, diba? First, do no harm. Yung pa rin. First, do no harm.
And even without vaping, there are already many lung problems you have to take care. You're already busy.
As I mentioned, diba? May asthma. Kaya, isa sa mga triggers ng asthma, change of weather. Kaya, as a pulmonologist, okay, dami na naman ng konsulta kasi change of weather, pupunta ng asthma.
COVID.
Yun pa. Maraming madalas natatanong about COVID. Yes, like, how is it related to smoking?
Yes, maganda yan. Before we continue with that, just...
Yes. Di ba, kunwari, COVID, di ba, ang turo pa rin, the minimum health protocol, wear a mask, physical distancing, di ba? Don't touch anything, don't touch your face. Okay. So, syempre, pag maninigarilyo ka or mag-vape ka, first, natunggal mo mask mo. Kadalasan, they smoke together. Di ba? May kasama. Ay, kaya ka mapapasmoke kasi yung kaibigan mo nagsismoke ka rin. So, you're smoking together. So, lahat yun, parang adds risk to you getting COVID. And then, ito personal story. I have a cousin who died of COVID. And she's in her 70s. And this was just last December. She's in her 70s. She was a smoker. And then, nung nagka-COVID siya, nadala siya ng maaga sa ospital. So, dapat okay. Dapat maganda yung batting average niya. But since she's a smoker, nakitaan na may emphysema siya. The long and the short, she died. Okay? So, malaking bagay na you prevent. Diba? So, prevention pa rin. So, kung nakikita na natin ngayon pa lang na yung mga naninigarilyo, ito ang epekto, sana sa next generation, hindi na yun ang problema rin natin. Diba? So, the thing is really prevention. So, may mga panukala na sana na, actually, I forget what country that is, not anyway, but na-mention before ni Dr. Yul Dorateo, that there are countries na, if you are born in the 2000-something, hindi ka na dapat pwedeng bentahan at all ng sigarilyo. Kasi
what country is that?
I forget. Was it New Zealand? Na ang goal nila is yung next generation, smoke-free na talaga. And if their reason is yung tobacco farmers, ang ginawa nila sa mga ganong country is binigyan sila ng ibang aanihin. Diba? Iba yung ipaplanta. Tama ba?
Yes. Ibang itatanim.
Ibang itatanim. Ani is harvest pala. Okay, sorry. So, iba yung itatanim nila. So, you're gonna give them another source of income, not tobacco.
Thank you. May sasabihin, thank you very much, Dr. Corinne Abansenia. May i-add si Dr. Amy Mateo.
Okay, doon sa unang tanong mo, bakit kami pulmonologist gusto namin maraming may sakit sa kalbo?
Yes.
Hindi naman kung ganun yung vocation na sinasabi namin. Health is our business. So, pag sinabi yung health, good health, no? Hindi diseases lang ang business namin. At saka, we'd rather see healthy people na nagpukonsulta sa amin rather than marami nagpukonsulta and then catastrophic or end stage na yung mga sakit nila. Mabuti kung asthma, okay, control, mabuti kung once in a while infection. Pero ito po, imagine po ang pag-smoker ka, chronic illness po ang maging magdudulot dito. And in the worst scenario, aside po doon sa... Hello?
Yes.
Yan po. So, pasensya na po. At aside po doon sa mga sakit pa, yung smoking compounds, no? It makes the illness more complicated. Nasabi niyo po yung relationship ng smoking sa COVID. Meron mga studies na po, simula ng 2019, na tumataas talaga ang severity or prognosis na sumasama ang outcome ng isang taong smoker na nagka-COVID. Ilan po siguro gusto namin mag-try ang business namin sa doctor. But remember, we are of service. And health is our business. So,
Thank
health,
you.
that means good health, health, preventive rather than curative, at rehabilitative dahil sa chronic, irreversible.
Thank you very much.
One Dr. Corey, of course, hindi po kami nagdarasal na dumami may sakit. Mas gusto mo namin, lagi po kasama sa namin. Sana po ay gumaling na mga pasyente.
Thank you very much, Dr. Amy Mateo. And to the two NGO representatives here, what are your reactions to the silence of the new president for the bill to lapse into law? And what are your next steps to respond to this dangerous vape law? And will you go to the Supreme Court to question this legally? The questions of Ms. Jasmine Romero, ABS-CBN.
For one, dun sa silence nung presidente, kailangan siguro mas ma-brief pa siya on the matter. Sinabi ng ating mga legislator champions na kailangan maparinig kay President Marcos na itong batas na to ay makakasama sa ating mga kabataan, and maybe that silence is influenced by the lack of information, and we need to engage with the President on that matter. Pangalawa, in terms of the next steps, nasabi ko kanina na there's a transition for this new law to be implemented, and for the health advocates, we'd like to be engaged in that transition and ask our government agencies to be strict in the implementation of the present law. Ulitin ko ulit, the present law is strict until the next 21 months in terms of age of access at 21 years old, and non-smokers cannot access these products. Flavors are not allowed, only two, plain menthol and plain tobacco are allowed. GHW are going to be implemented, yung graphic health warning po, yung sinasabi ko. And in terms of the jurisdiction, ang FDA pa rin po ang may jurisdiction nito in the next 21 months. In terms of the question on any act or legal action sa Supreme Court,
Can you go to the Supreme Court to block it, to question it?
Ni-raise na po yan ng mga medical doctors at saka ni Senator Pia Cayetano, and of course the advocates are supportive of any moves, Kami po ay magpo-provide lang po ng mga information or any help that we can get, our medical doctors are the experts on this issue in terms of the health effects, at saka in terms of the intent of our legislators to reverse it. Of course, we will support anything for public health.
May tanong dito, are we one of the worst in terms of vaping and smoking in Southeast Asia? How do we compare with our ASEAN neighbors? Are there other countries with progressive reforms that we should copy, or is the multinational vaping interest all over the place also? Curious lang daw.
Magandang tanong po yun in terms of benchmarking in Southeast Asia.
Yes.
Of course, we stand in terms of level with in Indonesia kasi malaki ang industriya ng tabako sa Indonesia, and in terms of the population, kasi mas malaki silang bansa sa atin, in terms of support of the government. However, we are also progressing in terms of our policies, and we also see some progress in our Southeast Asian neighbors. For example, Singapore bans these products. Very strict sila sa regulation. Thailand, especially, alam niyo po, if you go to Thailand, they're very strict in terms of vape devices. Pag tourist ka, bawal din po. So, what we are seeing is that our neighbors are going strict, even to the extent of banning. Pero in terms of the Philippines, ang direction natin in terms of policy should be strict regulation. Kasi sinabi nga ni Senator Pia, yung banning, tapos na yung usapin na yan. Sana wag nang gamitin ng industriya yung banning namin. Ibaban yung produkto. Tapos na yung usapan na yan. It's an old issue and should not be rehashed, just to confuse the issue. Punta po tayo dun sa strict regulation. At dun dapat yung direction natin. The state should have a state policy on strict regulation of vape products and heated tobacco products. And our stand is, our present regulation, hindi itong vape law na bagong-bago, ang present regulation ay stricto na at dapat na maipatupad, dapat na protektahan, at if possible, ma-amend or reverse yung bagong vape law para mabalik dun sa strict regulation na meron na po tayo.
Thank you very much. We have time for maybe one or two more last questions because we are running out of time. Thank you very much for all your many inputs and very enlightening crash course ito. May tanong pa dito. Maybe we could request daw your appeal, last appeal from all the our four panelists. Your appeal to the public, to the media, and to the government, since this is National Lung Month, August. By the way, bago we proceed to the closing statement, sino magaling na tao nag-isip ng Lung Month for August in the Philippines? Do you know anybody who proposed this? Who was the one who proposed this? Is there any president?
Ito po, World Health Organization guideline to, no? It's a program by the World Health Organization. May mga programa yung World Health Organization on World No Tobacco Day, for example. Ito po every end of May, ano? And ito ngayon naman sa August, World Lung Month, ano? At napaka-importante na ma-observe natin to. At madagdag ko lang po, Sir Wilson, no? In terms of how worse we are as a country sa vaping. Yes. We are the highest, no? In terms of prevalence on vaping sa buong ASEAN region. Ang Pilipinas, about 14%. In terms of the GYTS, Global Youth.
What do you mean by 14%? 14% of people
are the youth. On the youth. Global Youth Tobacco Survey.
15 to 19 years old.
Nakasama sa Global Youth Survey, about 14%. And that's like an old data, 2019. Between that up to now, ano na po yung percentage yung nag-vape? And you can see it, no? Makikita niyo po sa mga tabi-tabi, sa mall, sa mga pinupuntahan yung common areas. Ang dami ng bata ang nag-vape.
So nagiging, this is you are alarmed.
Yes, exactly. Siguro si Doc, may ma-share ka in terms of...
Before that, we'll go to the
Actually, I'm glad you mentioned it. Kasi meron tayong ginawang pag-aaral dito sa Pilipinas na noong 2019 before the pandemic. Yung mga grade 7 to 9 students na inalam namin kung ano yung rason kung bakit sila sumusubok. And ang nakita doon is peer pressure. Kasi kung makaibigan nila na sigarilyo, so mag-smoke din sila. Tsaka yung flavors. Kaya kami we're very adamant about really pushing na walang flavors kasi nga yun yung nagpapa-entice sa mga bata para sa
parang milk tea.
study.
Parang milk tea, maraming flavor.
Yes.
So nai-entice sila.
Yes.
May feedback po sa amin, friends, na parang Marcos era pa pala yung start ng celebration natin. Marcos Senior era
Oh,
start ng Lung Month.
In fairness, the Lung Month was started by the father of the present president.
Oh, 1978 pa po.
Wow.
Maganda sana, no, na suportahan.
Maganda.
Yung
So, started by the late President Ferdinand Marcos. So, this is a good excuse for you to remind the son that it was the father who started Lung Month celebration every year.
Noong 1978 na noon sinimulan natin. So,
may suggestion ako sa inyo, to the four of you. Why don't you write a nice letter since this is the Lung Month started by the father, maybe a message about lungs, about protecting. Write a letter to him asking him to publicly endorse lung protection. Diba? We'll play a video before we go to the closing statement. May video, our four NGOs. Can we show the short video? Galing mag-research, 1978. Wow! Ginugal. Magaling si Mr. Google.
Ako si King Villanueva, 18 years old. Nag-aaral po. Grade 12 senior. Ako naman po si Arsen Cayo Pangilinan, 19 years old. First year college po. Pugyani Omega, 18 years old. Incoming principal. 19 na ako nagsimula ng vape. Noong edad ko po nung nagsimula ako ng mag-vape, 17 years old.
Nagsimula ako nung vape nung 16 ako.
Kapag inugusto ako sa vape pag na-stress na sa paglalaro ng email, kaya mawawala yung stress mo sa computer nag-vape ka. Naalaman ko yung about sa vape.
Sa social media, sa mga napapanood ko. Kaya nainganyo po ako bumili tsaka lumamit ko ng vape.
Nainganyo po sa barkada yung, kasi barkada ko, lahat sila nagbibig. Tapos, nainganyo po, nalakas po ng uso. Masarap din po yung lasa. Hindi po katulad ng Yossi.
Yung dahilan ko ng pagkagusto sa vape, yung iba't ibang uri ng juice.
Yung pinaka gusto ko sa flavor ng vape ko, yung almond po. Kasi sakto lang po yung tamis niya.
Yung paborito ko pong flavor ay kasi po menthol po siya, tas masarap po. Vanilla po. Isa rin po sa mga paborito ko ng flavor po. Kasi po isa po siya sa masarap na flavor. Nakaka-mix po talaga.
Pag bumupaka ako ng vape, malamig siya, tapos pag binuga mo, maganda sa paramdam, tapos maamoy pa siya. Mabango siya sa lalo pag menthol. Ang gusto kong flavor yung millennial, menthol siya, tapos ang sarap pa sa bunganga, ang lamig.
Ang budget ko po sa isang linggo, isang buwan, 800 to 1,000. Yung budget ko sa isang buwan is 200 to 250.
Budget ko, maximum, umaabot ng 350, 300, 400. Yun lang po ang higit ko ng budget. Depende po kasi kung ano bibili ko.
Doon sa online store na pinagbilang ko, kahit anong edad po, pwede po bumili.
Hindi naman po nila tinatanong kung ilang taon ka na. Noong 16 ako, nag-uutos din ako sa barkada ko na hindi minor, na magpapabili ako. Then yun nung nag-18 ako, nagsasarili na ako bumili sa vape. Alam kong minor tayo 18, siguro 19, gano'n. Parang ano ba yun? Buo na yung pag-iisip ng 18.
O 18 po. 18 pataas po yung pagbibig ko sa kayo po. Siguro po 18 pataas po. Parang pag 18 ka na, pwede ka na kumuha ng ng mga mahal.
Parang hindi na mainom.
Hindi na po ako mag-bibig. Ang flavor na lang po ay yung sigarilyo na mapayat at menthol po. Siguro po hindi na po kasi nagustuhan ko lang naman po dito sa vape yung tamis po ng mga flavor.
Gusto ko rin naman po yung malasa ng usok. Pero kung gano'n naman po yung lasa,
Hindi pasok sa taste ko. Hindi na rin po ako bibig.
Hindi ko rin alam kasi hindi pa ako sure kung dito, parang ulang.
Thank you very much. The dangers of vaping. And before we go to the closing statement now, we're ending soon. I heard lang, and I want to verify with you, na the ones who also, aside from they voted against vape bill, Pia Cayetano and Kiko Pangilinan last Congress, I heard also right now lang, na marites ni Dr. Abansen niya sa akin, na Senator Bongo abstained, and also Senator Manny Pacquiao. Am I correct? Who else abstained? Are these the only two people who abstained? Yes. Sila, no? Senator Pacquiao told me when he was a kid, he was smoking and he stopped it kasi it's bad for athletes. So we'd like to invite everyone for closing statement. First, maybe the one in Zoom, Dr. Amy Mateo. Can you summarize your position, your appeal to the President, to the legislators, and to the public through the media? Your closing statement, Dr. Imelda Mateo, President, Philippine College of Chest Physicians, especially ngayon, lang month.
Muli, magandang araw sa ating lahat. At ako po, representing the Philippine College of Chest Physicians, supports at in agreement sa stand ng Department of Health, ng FDA, ng Philippine Medical Association. Ito po yung country's largest medical society, consisting of 8 doctors, the Philippine College of Physicians, the Philippine Pediatric Society, the Association of Philippine Pediatric Immunologists. Isa din po ng Department of Education, other 60 civil society groups. Na kasama na rin natin po sila sa Syntax Coalition. We appeal to the President to reconsider and do something to reverse or revert the law, the vape bill law, para hindi ito po maging accessible sa younger age group. Para mag-protection na natin ang ating mga kabataan sa ill effects of smoking and vaping and e-cigarettes. So, tayo po, hindi lang kami health advocates, no? We are advocate also of a cleaner and safe environment. At alam po natin na ang vape, yung smoke na iniinis ay composed of harmful chemicals, no? Na meron nga ako mga chemical na nabanggit na si Dr. Paul, na wala naman sa ordinary mga diacetyl and propylene glycol na ginagamit natin sa mga aircon, no? Na hindi po dapat for human consumption. So we are with everyone that will promote a safe and healthy environment for our youth, our future, and hopefully we long for a smoke-free environment. Smoke, tobacco-free, vape-free, and e-cigarette-free Philippines. Maraming salamat.
Thank you, Dr. Amy Mateo, President, Philippine College of Chest Physicians. Next, we'd like to invite for closing statement, Suki of Kamuning Bakery since 1970, Dr. Cory Abansenia of the Philippine Pediatric Society.
Salamat po ulit sa inyong pakikinig. So, in celebration of Lang Month, so, ang maganda na sineselebrate po natin ito, natutuon na ng pansin, di ba, ang bagang. And being a pediatrician and a pediatric pulmonologist, ang gusto namin, ang tagline namin is not one puff ever. Not one puff ever. Ang isang, pag ikaw ay nanigarilyo, merong 7,000 chemicals kada puff, kada hit. It's not even
7,000
chemicals
per puff.
Per puff. So, ang akala nila, pag naubos mo yung sigarilyo, doon lang yung 7,000. Hindi, it's kada puff, kada hit mo.
Oh,
Meron kang
shocking.
7,000
chemicals sa bawat puff. Ano ang puff sa Tagalog?
Hit?
Hit. Grabe.
Kasi, yun, tama hit.
Ay.
And the thing is, ang alam lang natin, pag sa baga, cancer. Pero, hindi lang yun, bronchitis, asthma, TB, lahat yun, kasama pa rin sa baga. And more than the baga, yung buong kalusugan is important. So, as we said, diba, we don't want it safer. We want it safe. We want a safe environment. So,
maganda sinabi nyo. Yung claim ng mga vape people na they are safer daw.
Yes.
They are claiming they are lesser evil. But evil pa rin.
compared to
Evil pa rin.
traditional cigarette, they are
Yes.
safer.
Daw.
We don't, daw.
Sabi
But-
niya eh. Hindi
yes.
pa conclusive.
So, hindi
Yeah,
pa
daw.
not yet backed by science. But what we want is our environment to be safe.
Sorry to interrupt. Why do I see several doctors' names in public endorsing vape? Curious. Very weird for me.
Yes, very
Bakit,
different.
bakit?
Maybe, well, I don't wanna, second guess them. But maybe in their minds, if they are users, it helps them. But we are talking public health. So it can't just be personal. Kasi it helped me. You have to help everybody. So when you talk of everybody, hindi lang yung smokers ang tutulungan mo. Kung talagang, like in your heart, you really want to help smokers, then you tell them to go to the Wishpit line, smoke patch, the nicotine patch, diba? The nicotine gum, kasi yun yung subok na. So kung talagang gusto mo silang tulungan, dun sa subok na. And you don't want vape to be available to the non-smokers, as I mentioned earlier, to the youth. So, kaya gusto natin safe, diba? Not safer. So, and not one puff ever because the nicotine, diba? You don't want to wake up that nicotine receptor. Kaya, not one puff ever. So, credit to the owner, but we use that tagline in Philippine Academy of Pediatric Pulmonologists.
Who invented this tagline, sabi niya, since the owner?
Actually, hindi ko rin alam, pero that's why we always just say it's credit to the owner. Because when we were making, kasi nagle-lecture po kami sa mga eskwelahan, sa mga lay people, sa mga barangay-barangay, and isa yon sa mga nasa slides po namin. Tumutulong paano tumigil, magsigarilyo.
Not even try.
Not even try. Kasi ba sabi nga sa inyo, ako ang palaki sa akin, just don't waste my money. Diba?
Yes.
Just don't waste my money. Pero sa amin, not one puff ever. So, because it's that nicotine.
It's poison.
It's poison. So
don't try even the little poison.
Nicotine won't kill you. It will make you addicted. It's the tar that will kill you.
Tar, T-A-R. Wow.
And that's the one in cigarettes. So sa vape, diba? Ngayon, hindi pa enough yung pag-aaral. Pero so far, ang lumalabas sa mga pag-aaral, hindi rin ito healthy.
Talagang masama.
Masama rin siya. Kasi nga, safe sa food coloring, sa aircon, and you know, all those chemicals are being used for other purposes. But to be inhaled, definitely masama po siya.
Last, may sinabi kayo kanina 2 times na very intrigued ako na you said, we all know second-hand smoke is dangerous. Pero nagulat ako, first time ko narinig, encounter, akala ko marami na akong alam. You said third-hand smoke is dangerous. You said on the wall, on the clothes of people. So yung mga tao na may asawang makulit, hindi makulit, na addicted sa sigarilyo, yung mga misis nila, kasi yung damit nila, kung nasa labas sila nandidikit yun, pagpasok sa bahay, all their clothes are full of smell pala.
Yes.
So third-hand smoke is dangerous also.
Yeah, so kung karga mo yung anak mo, diba, minsan isusok nila
And in the hotel room pala, when you go in and you smell smoke, that is third-hand smoke pala.
Yes.
In the hotel room, if there is, you have to change to non-smoking room.
Yes. Kasi nakadikit din yun sa dingding, sa floor. So kung yung bata gumagapang, na-absorb din yun ng skin nila.
Ang galing, grabe. We should have another this session with all the details. Can we, the NGOs, can we invite the Senator Kainano come here one time to personally talk? I heard or read that she used to smoke before and stopped, or totally not. Diba? Thank you. Next, we'd like to thank you very much to Dr. Cory Abansenia of the Philippine Pediatric Society, pulmonologist also. Next, Miss Imelda Cotano, all the way from Davao City, flying here just to speak. She's the lead of the Parents Against Vape. Your appeal and your closing statement, ma'am.
Okay, so but before that, I want to add.
Yes, bilang nanay.
Kasi po ako, sa Davao City po, sa Davao po, I'm managing my own birthing facility po. So, ang patient po namin mga nanganganak. So,
birthing, akala ko birthing facility.
Birthing
facility, very good.
Po.
Yes.
So, before namin dini-discharge yung patient, yung mother with baby, yun po yung isa sa discharge instruction namin, na yung baby, wag ipapaamoy ng smoke, kung may nag-smoke sa bahay. So, bago halimbawa yung tatay nag-smoke, kailangan maligo muna siya mag-toothbrush para...
Bago lumapit sa bata.
Kasi kahit sa labas ka nag-smoke, pagpasok mo ng bahay, yung nag-observe yung kinuha.
Maganda yung kinikwento ninyo.
Relate ako doon. So, then ito po yung closing statement ko po. Kami po sa Parents Against Vape ay nananawagan po sa ating Pangulong si Bongbong Marcos sa for the strict implementation and regulation po ng vape para po sa mapangalagaan po natin ang kalusugan at kinabukasan ng mga mamamayan, ang mga batang Pilipino po. Maraming salamat po.
Baka pwedeng isang short line in Bisaya since marami daw Bisaya sa Pilipinas, more than Tagalog daw. Yung last president natin na sikat Bisaya. Kahit ay short line na appeal about vaping sa Bisaya na huwag kayo mag-vaping or sigarilyo.
Nanawagan ko sa tanang mga sa ato ang mahal na Pangulo na kung mahimo istriktohon nato ang pagpatupad sa niining mga regulasyon sa vape aron mapangalagaan nato ang atong mga kabataan sa ilang mga panglawas o sa ilang future. Salamat.
Thank you very much. Sikat na ngayon ng Bisaya, second national language. Last but not the least, we have a young attorney, Attorney Benedict Nisperos, consultant of health justice. Can you please summarize your appeal about vaping, smoking, and lung month?
Ngayong lung month po, ina-highlight natin yung proteksyon ng ating lungs. And we from the health advocates believe that the strict regulation of vape products, of smoking products, would protect our lungs from these harmful and toxic products. Dahil Ilocano ako, Ilocano naman yung presidente, siguro pwede rin na Ilocano.
Ilocano naman kayo.
Kasi nagbisaya si Ma'am. So,
saka milyon kayo, ang dami niyong burrito. Ang dami niyo. Saan niya sa Ilocos?
sa La Union po ako.
O yan,
My mom is from Ilocos Sur.
So, paki-appeal in Ilocano to the president and to the public.
Apo Presidente Marcos, si kami na apela kanya yung dapat nga di stricto ti regulasyon ti lintig para iti vape kan tobacco sapay kumaapong i-protektahan tayo iti health kalusugan iti naduma-duma lalo na digubing and sapay kumaapong pakinggan yun ti ibagbagami and hopefully in the future we get to talk with you and explain to you yung health benefits and economic benefits of our advocacy. Yun lamang po. Maraming salamat sa pagkakataon ito. Thank you.
Thank you. Bago we end, may tanong dito. There's a question. Sabi kanina kasi ni Dr. Pansenya, they have a tagline. Do you have a hashtag? Kasi sa generation natin, na millennial, nakikimillennial, may hashtag ba kayo against vaping and against smoking? This long month, do you have one or maybe you can think of one? Do you have a hashtag for social media, Facebook,
yung
Twitter, Instagram?
2 years na po namin ginagamit yung Be Safe, Don't Vape,
Be safe,
Don't Vape.
Don't vape. That's your,
For the longest time, 2 years na namin ginagamit.
Hashtag.
Be Safe, Don't Vape. Actually, yung hashtag na yun pwede yung hanapin sa social media.
Yes.
And yun nga, panawagan din natin sa media, sa ating mga kasabahan sa media at mga nakatagapakinig sa social media. Suportahan po natin yung ating kampanya. This will benefit a large majority po ng ating populasyon. We recognize na may mga smokers na gustong mag-transition, gustong mag-quit. May mga ways how to do that. But first, we have to protect the larger majority of non-smokers, especially our children and the youth, from the harms of these toxic products. We have to protect them kasi kung mas madali nilang ma-access itong mga produktong ito, mas magkakaroon tayo ng mas malaking problema or ng epidemya. Maraming salamat po.
Thank you very much to all our panelists for all of that. Thank you for the support of the media. Don't forget again, let us promote National Lung Month this August, and the best way to protect our lungs, discourage vaping, discourage smoking. Kung pwede nga, sana, can we be like Singapore, si Lee Kuan Yew, totally ban smoking at one point? I know, sana we can do that. As our moral support from Kamuning Bakery, we give you Pandesal support also. So let us have a picture. Si Dr. Amy Mateo, we will send you a Pandesal, paki-message lang, where we will send the Pandesal gift. To all the media, also our humble gift. Let's have a Pandesal photo op. We support anti-vaping, anti-smoking here at Kamuning Bakery Cafe, Pandesal Forum. This is one of our favorite topics. we are for health. Thank you. Let us stop smoking, stop vaping. By the way pala, my father died when I was 7, lung cancer now, and went to bones. I heard. Yes. Yes. Yes.
Yung nag-invent ng vape kasi his dad
Yes.
died of lung cancer.
So he invented vape to lessen, to have an alternative.
But they marketed it, that's why they marketed it as harm reduction.
Yes.
Because of that. Pero yun nga, it has
But
to be
still,
regulated.
it's still, yeah. Thank you very much to everyone. Let's have simple lunch. Thank you.